Hi everyone, today I will be performing a clinical bedside evaluation on my patient. Now there are two parts to a clinical bedside evaluation. There is the oral part and then as well there is also the feeding part. Unfortunately we cannot see all of the oral structures and the functions, but this can give us a better idea as to my client's swallow. Now, before we get started, I'd just like to note that typically I would be wearing gloves for this, but for the sake of this video, I have washed my hands. So, also, I would like to make note of my client, just before we even begin, that there is no presence of a tracheostomy, and his respiration also appears to be normal. So, let's meet our patient. So, hello, my name is Amanda, and what is your name?
My name's Josh.
Josh, and how are you today, Josh?
I'm doing good.
Good. And Josh, can you tell me what day it is?
March 25th.
So the reason I ask these questions is one, just to check his cooperation, just to see if he's going to be cooperative with me, and to see if he's willing. So, and also I was checking his alertness and orientation, so he knew his name, he was able to tell me how he was feeling, as well as what is today's date. So, let's get started. First, we're going to start with oral mechanism exam. And for that, I have a flashlight and I have a tongue depressor. So this oral mechanism exam is done to assess the mechanism and the features that come along with it. And so that we can make sure that his oral mechanism exam can properly facilitate a swallow. So the first thing we're going to do is we're going to check his lips. We're going to check for his lip seal, and as we know, this is going to be done to assess the lip strength, and it can help to propel the bolus as well as contain the bolus. So let's get started. Josh, I need you to open your lips for me. Can you smile for me? Can you smile with your lips closed? And now can you pucker? Very good. Now I need you to smile and pucker like this. Very good. Now, I'm going to push this, and you're just going to pucker for me, and then push. Very good. All right, now I'm going to have you spread your lips, and you're going to sustain an E.
E.
Very good. And now you're going to say ooh.
Ooh.
Good. Now we're going to do that back and forth. So we're going to go E, ooh, E, ooh. Can you do that for me?
E, ooh, E, ooh.
Very good. All right, now the last thing we're going to check is your cheeks. Can you hold air in your cheeks? Puff them up like this. Very good. And now I'm going to give a little push, but don't let me push it out. Good job. Okay, so as you can see, I was able to kind of check and make sure that his lips were able to stay closed, even when pressure was applied here and here, so that he could just kind of facilitate the ability to contain that bolus and not have any spillage out of the front or side of his lips. So the next thing we're going to do is we're going to check lip movements. Again, this helps to contain the bolus, as well as checking for sulci, checking his anterior and his lateral sulci in case of any leftover food in his mouth. So now we're going to check and see your tongue. So can you put your tongue out like this? Good. And now can you move to the sides? Good. Other side? Now can you move it back and forth? Good job. And now let's open your mouth up. And now can you tip your tongue up? And now the back of your teeth. Good. And now to the back of your throat. Very good job. All right. So now we're going to check his tongue strength. Again, this is going to show the ability to contain that bolus. It's also going to give us an insight on his ability to manipulate the bolus, as well as his ability to generate pressure to propel that bolus posteriorly. So let's get started. Now I need you to stick your tongue out to one side, but don't let me, now you push on my, good. All right, now let's go to the other side. And good, very good. Okay, now can I have you lick around your lips? Very good. Now we're going to say ta.
Ta.
All right, now I want you to open your mouth up real wide for me. Now let's look inside here. I'm going to use this real fast. Good. Now let's put your tongue down and let's say ta.
Tuh. Tuh. Tuh.
All right, now, can you say, open your mouth up a little and say "k"?
K.
All right. So what I was doing there was I was just checking his features. I should have done it at the beginning, but we were just checking his features to make sure he didn't have any missing teeth, making sure that his tongue didn't have any scars on it, and just kind of checking for those features to make sure that everything was appropriate to facilitate that mastication as well as that swallow. So, and by looking at the "tuh" and the "k", I was able to look at his velum to make sure that it was moving up and down, to make sure that it was closing off. It had the ability to move to close off that nasopharyngeal port. So now, Josh, I'm going to check your jaw. So the reason I'm going to check his jaw is to make sure that he can do that rotary motion when it comes time to chew the bolus. So, Josh, can I have you just open your jaw up? Very good. Now close it. Now do it again. And now close it. Very good. Can you move it side to side? Very good. Okay. Now I'm going to apply a little bit of pressure right up in here, and I need you to open and close again, okay? And one more time. Very good. So by applying that pressure, I was able to see if he had any TMJ up in here, and also to see if there was any pain, but also just to make sure that he has the ability to move his jaw up and down. Now, I'm going to put this in your mouth, and I'm going to check your gag reflex, okay? The reason I'm checking his gag reflex is to make sure that he can gag. So in case that something gets stuck in the back of his throat, or in case he aspirates, he has that ability to gag or kind of catch it in the back of his throat so that it doesn't go too far and cause him to choke or cause him to aspirate later on. All right, you ready?
Uh-huh.
Now, I'm just going to slowly inch my way back, okay? Very good. Okay, so that just provided us with an insight as to his sensation. So he does have that sensation and the ability to feel food in case there was some premature spillage or in case something gets stuck in the back. So now I need you to say "ah" when I tell you to, okay? So again, this is going to check his velum, his soft palate, and it's going to check the movement and the ability to close off his nasal cavity, okay? So Josh, I just need you to say "ah." All right, so now let's say "ah, ah, ah, ah." All right, and now I need you just to say "ah" until I tell you to stop, okay? Okay, you can stop. Okay, now the last thing I'm going to check as part of this oral mechanism exam is just a voluntary cough. Okay, now this isn't a realistic look as to what might happen if he was to aspirate or penetrate, or if he was to swallow something wrong, or if he was just trying to clear his throat. But this does show us that he has the ability to physically cough, okay? So Josh, let me, can I see you just cough? All right, so that did show that he was, it did represent that he could cough. Like I said, it's not realistic for that to be his cough if he was to aspirate or penetrate and was to show a response to that, but it does show us that he does have the physical ability to cough. Okay, now we are going to start on our eating portion, and I have a glass of water as well as some juice. I have some applesauce, I have some pudding, and then I also have some graham crackers. So again, I would like to mention that with a bedside, we cannot see the internal structures and how they function, but it does give us a closer look as to his ability to swallow, okay? So, Josh, I want to have you take a little sip of this. Just a sip, not a large drink, okay? Just a sip. All right. Now, what I had him do was just take a sip before he takes a big drink. And I was looking at all of these. I'll be looking to see if he has any leakage or any food that comes out the front, any food that comes out the nose. And I'll also be checking for a couple other things. But I'll also be checking for that. Now, Josh, I'm going to have you do another drink of this. But this time I'm going to put my hands under your cheek. my fingers under your chin so that I can feel for some of your muscles moving, okay? So you can take a bigger drink as I feel under here. All right, so what I was feeling for was his hyoid movement. So that initial hyoid movement to move it up and just to kind of get some of that timing. Okay, Josh, do you ever feel yourself having some premature spillage or having some spillage come out of your mouth or your nose whenever you take drinks?
No.
Okay, so now we're going to we are going to take a sip of juice. So this is a little thicker, and again, Josh, we're just going to take a sip, and then we'll take a larger drink, okay? And I'll feel for your movement again, okay? So let's take a drink of this. All right. Again, you saw there was no spillage coming out of his mouth nor his nose, okay? So now I'm going to feel his hyoid again. You can take a bigger drink of that. All right, so typical transit time for a normal swallow is about 1 second, okay? And that is from, that is his laryngeal movement until the initiation of his hyoid movement, okay? So from posterior to the bottom of his velum down. So now we're going to move on to something a little bit thicker than the juice, and we're going to do some applesauce, okay? So I'm going to feed him just a little bit of applesauce, and to he's gonna swallow, and I'm gonna see what he does, and then he's gonna swallow again, and I'm gonna feel in his hyoid. Okay, so I'm also gonna be looking to see if he has any leftover bolus, and also to see if there's any and also to see the time it takes for him to initiate the swallow. So from the time it enters his mouth until he swallows. All right. So I'm just going to watch you this first time, and then we'll do the feel again, okay? All right. So as you can see, there was nothing that came out the front or out of his nose again. Now, Josh, can you open your mouth? All right. Move around a little bit. So I was just checking his sulci to make sure that there was no leftover bolus on his tongue or in his sulci. All right. So now I'm going to give you a little bit of a bigger bite, and we're going to feel. All right. So that transit time was about 1 second. It didn't take long because it's a little softened liquid, little softer food. But now we're going to move on to something that's a little bit thicker. Okay. And the reason I'm feeling, again, is I'm doing this to determine the time of the initiation of that laryngeal movement until the initiation of that hyoid movement. So, and this is done so that I can time the trigger of his pharyngeal swallow. All right, Josh, so I'm going to do the same thing where I just give you a little bit and watch you, and then we'll give you a little bit more, and I'll feel, okay? All right, very good. Now, we're going to do that one more time. All right, very good. So obviously we cannot see his pharynx. It can't be seen, but we can identify through his hyalolaryngeal movements. So we can look at the smoothness, and we can look at his maximal elevation. All right, Josh. So I'm going to have you do this once more. And this time after, you're going to swallow, and you're going to say, ah, okay? So I'm just going to listen to your voice and see how that sounds, okay? So, swallow and say, ah. All right, so what you can see is from the beginning to now, nothing really has been affected. So his voice still sounds the same, and it's clear, and it's crisp, and it's loud. Okay. Now, Josh, we're going to do that again, and this time I want you to pant afterwards and say, ah. So you're going to take a bite, you're going to go, ah, okay? Very good. Okay. Now, this time, I want you to take a bite, and you'll turn your head and say, ah, okay? All right, one Once more to the other side. All right. And now this time you're going to take a bite and you're going to put your chin down and say ah, okay? All right. So what I was checking for was, again, to see the smoothness. So, again, we can't see that. This Toman's going to let me see. So as I was saying, you can't see that pharyngeal swallow, but you can see this. You can look at the smoothness and that maximal elevation by listening to the quality of his voice. All right, so now I'm going to have you take a bite of this cracker, okay? And so you'll chew this, and then we'll do the same thing as before, where you chew it and I feel, okay? So that's for you, and you take a bite of that. And you can just eat that whole thing. Okay, so just what I was able to observe was that he was able to contain, his lips were sealed, he was able to contain it, and he even, after he swallowed, he did a double swallow, and he used his tongue to remove the remaining portion of the bolus from his lateral sulci. So now I'm going to look in his mouth and see if there's anything remaining on his tongue or in his palate. Would you open your mouth for me? All right, let's check your sulci. All right, your tongue one more time. All right, so his mouth is clear, and so that's good. So he was able to clear the bolus from his tongue. And again, like I said, you can't see that pharyngeal swallow, but all we can do is feel for that movement. So I'm going to have him chew one more time, and I'm going to feel for that hyaloid movement. All right, Josh, so you're going to eat this, and I'm going to feel your throat as you chew, okay? All right, very good. So I was able to feel that hyaloid movement. And now, Josh, can you say, ah? Very good. All right, now let me look in your mouth once more. All right, very good. So his sulci were clear again, and his tongue was clear once more, and his voice quality was still good. So again, that pharyngeal response goes right along with that pharyngeal swallow, and we're just listening for his vocal quality and if he coughs in response to his swallow. So the last portion of this is his esophageal phase. This cannot be assessed, obviously, but we can ask a couple questions to kind of determine if there's anything kind of that needs to be assessed. So Josh, whenever you swallow, do you ever feel that there is something that gets stuck kind of in your chest or in your throat or anything?
No.
Do you ever find it difficult to swallow?
Mm.
No? Okay. So, as I had mentioned before, the oral mechanism exam and this eating portion of this, so just the bedside evaluation, doesn't give us necessarily too in-depth of a look because we can't assess the internal structures and functions, but we can have a better understanding of our patient's swallow. So, Josh, thank you, and you can drink that.